La 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 lymphatic. It's like a shop vac, not a circle. Primary lymph vessels are called lymphangia. One section is an angion. La 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 lymphatic. It's like a shop vac, not a circle. Obliged to carry 10% of the fluid and all the chunky junk. All right, so let's talk about how the lymphatic system works, physically speaking. First, we've got some terms that we want to know, and I am on slide 6 in the PowerPoint. So let's talk about some lymphatic system terms. First, we have lymph itself. Lymph is the fluid inside. In fact, I think we can, I'm going to go to the next one. All right, so yeah, if you go to slide 7, lymph itself is the fluid that flows through the lymphatic system. Before it enters the initial lymphatic vessels, we call this interstitial fluid. So what happens is you have your capillary beds of your cardiovascular system. The red blood is going in, delivering the stuff to the nutrients, the water, the oxygen to your tissues, and then the capillary beds of the veins are sucking that back up again and returning it to the heart, right? Well, the thing is that the veins aren't big enough to suck up all the waste product and all the fluid from the tissues. So the lymph has to do it, right? The veins just can't carry all that stuff, especially some of the chunky junk, right? The larger proteins, the dead and damaged cells and cellular debris. If you've got junk in there because you breathed in a bunch of pollen, that pollen slipped into your blood with the oxygen, like the cat, scooting out the door. You didn't mean to let the cat out the door. You just meant to walk out the door yourself, but the cat got out anyway. Sometimes pollen and dust and stuff from the air, and even dyes and stuff from our food that's not oxygen or nutrients that we intend to absorb gets absorbed into our body anyway, right? And so the lymphatic system is the shop vac in the tissues. It's sucking all that extra fluid and chunky, gross junk up out of our tissues and sending it off to lymph nodes, etc., to be processed. So before the fluid is in the lymph vessel, we call this interstitial fluid. So in the space between our cells, right? And the lymph is made up, it's a lot like plasma from your blood. It's made up of water and proteins, cellular components, fats. It just has more proteins and junk and debris in it than plasma does. So what happens is we've got these initial lymph vessels. I should go back to terms. Yeah, we're making our way. All right, so we have these initial lymph vessels. So these are located at the dermal epidermal junctions. Do you remember how your skin, you have the epidermis, the dermis, and the subcutaneous layer. So between your epidermis, that's your outer layer of skin, and the dermis, which is a connective tissue layer with vasculature and stuff, right in there, this is where these initial vessels for your lymph are located. And these are the smallest lymph vessels. Walls are only 1 cell thick. And they create these one-way valves by having, so they have the one cell thick, hang on, maybe I should grab the picture in the book. I don't know if it's going to be, so in your modalities textbook, of course I closed it. I didn't think I was going to, myofascial release, come on, where's lymphatic? Here we go. Here it is. So I don't know if this is a very good picture or if you can see it. You could probably open your book and see it better. So this is a collecting vessel. And I don't know if you can tell, but we've got these little filaments coming out. And what happens is these collagen fibers are coming out of this vessel, and they're connecting to these cells, right? So these cell walls are just one cell thick. And I'm going to direct your attention right here in this one. Do you see how this is pretty closed? And in this one, how it's flapped open a little bit? I don't know if you can see that very well, but it's like flapped open right at that junction where that anchor filament has like pulled it open. And so that's how the water and the junk gets in, because the anchor filaments, as you move and as stuff happens, that pulls the cells, the flap open, so stuff can get into the cell. And okay, so this is going to come down to collector vessels. Like from those initial vessels, it's coming down to collector vessels, and those collector vessels are the transition from the initial vessel to the transport vessel. These have 1 or 2 cells thick. They don't have valves. It's just like the next biggest chunk on the road. And then you have transport vessels segmented into units. So the primary lymph vessel is called the lymphangia, and the units, each unit is an angion. So if you have a lymphangion, this is this unit in the lymphangia, in the primary transporting vessel. So it has, each segment it's from valve to valve, each segment is. Lymph can only flow in one direction because of these valves. There's a really good picture in your book that kind of shows this. And basically what happens is lymph flows in, the extra fluid stretches the valve, and there is a little bit of smooth muscle in that valve. So once it feels that stretch, it compresses down. And that pushes the fluid, and it can't go backwards because there's a valve in the way, so it's got to go forwards. So therefore, lymph has to flow along towards the lymph nodes. So lymph nodes' primary function is to filter and process lymph. You have between 400 and 700 lymph nodes in your body. Half of the lymph nodes are in the abdomen, so we have just a lot of them in the abdomen. Other areas of high concentration would be the neck, the axilla, that's your armpit, the inguinal area, that's the front of your hip by your pelvis, and the popliteal area, that's the back of the knee. And basically what's happening is these lymph nodes are where a bunch of immune cells live, and the immune cells are going to gobble up the bacteria, the cellular debris, and they're going to break it down into smaller pieces. Some of that can be absorbed from the lymph node back into the bloodstream there. I think about half of the fluid can actually be absorbed from the lymph nodes themselves directly back into the bloodstream, but a lot of it does continue on through the actual lymph vessels themselves. Right, so the terminus. So the terminus, as in like terminal, the end, right? The terminus is the end of the thoracic system. The lymphatic system. The lymphatic system is not like our circulatory system, which is like a cycle that's always, cycling blood and fluid around. The lymphatic system is more like a shop vac. It's going to suck the fluid up, and then it's going to exit the lymphatic system and go back into the bloodstream. So that exit is what we call the terminus. The thoracic duct and right lymphatic duct are where the fluid comes together. The thoracic duct handles all the fluid from the body. The right lymphatic duct handles only the fluid from your right upper limb, so your shoulder and like this quadrant of your pec and upper back, and this limb. Only about 5 to 10% of people actually have a right lymphatic duct. So for most people, it all is just coming up into the thoracic duct. But every so often, you've got someone with a right lymphatic duct also. So these ducts are located behind your clavicles, deep to your clavicles. And this is the site for fluid to return to the circulatory system. So when we stimulate this area, fluid uptake increases and we're able to like speed up the fluid dumping into our circulatory system. The thoracic duct empties into the left subclavian vein, and the right lymphatic duct, if it exists, drains into the right, empties into the right subclavian vein. Okay, and that is pretty much what we're going to care about for anatomy physiology, apparently. So our techniques do have the ability to increase fluid flow, I think by about, like, is it 20% or times 20? Maybe it'll be on the slide. So we do have the ability to increase the flow of lymph in the body as we go along. So that is basically what we're doing when we're doing lymphatic facilitation. So techniques for moving lymph. Lymph is always going to move within its own drainage area. We can't just make some go, like even though my neck and my shoulder are right next to each other, I'm not going to move lymph from my shoulder to my neck. I'm going to move lymph from my shoulder to my armpit, because that's the way the tubes go. The lymph is always going to move within its own watershed, its own drainage area or watershed towards the lymph nodes. Watersheds are indicated by blue lines on the slide 13. And basically a watershed is the drainage area where that the lymph is taking from, because it goes in zones and then comes along these trunks, right? On a lot of these lymphatic charts, you see a lot of arrows, and what those arrows are telling you is which direction the lymph is flowing in that watershed. So if you're at the top of the sacrum, it's going to flow outward laterally towards the edge of the hip. Because it's coming around to the front of the inguinal area at the front of the hip. You know, if you're in the upper chest, if you're in this area here, it's going to go out towards the armpit. But if you are like a little bit up, maybe it'll come down, or if you're down in the chest, it'll come out, you know. So if you're in the ribs, it'll come up towards the armpit also. So the arrows show us on these charts where we're directing that lymph to go. So when we're talking about these techniques, right, what is it we're actually doing? First of all, the pressure is very light. We can imagine a leaf floating on water. Basically what you're doing is you're just like melding with the skin and just hooking it enough to provide a little stretch. I wonder if I can, okay, so you can see, oh, here we go. So you can see my little freckles, right? So I'm not pressing into the skin. That's not lymphatic facilitation. I'm just hooking the skin and stretching it in the direction that I want to go. So I'm not pressing into the muscle, right? I'm not massively denting the skin. I'm just like hooking it with just the pad of my finger and stretching it. Stretch. And you can see by where those little moles on my skin are going, right? So it's very light. The direction that we're stretching, the direction of these strokes, is always going to be towards the nearest lymph node bed. And the rhythm is going to be slow with a couple of seconds between strokes. We have a specific order that we're going to do the body in. We're always going to clear the terminus first. So we're going to work on the head and then, sorry, we're going to work on like the neck, the upper shoulder, and the head first, because we've got to clear any congestion in this area before we handle any limbs. Because imagine if I have congestion in my neck and throat, and then I'm moving all this lymph from the limbs, and it's going to hit this traffic jam and be a problem. So we have to clear this area first. Then work on the lymph node. So first the terminus, then lymph nodes, and then applying strokes, starting on the proximal side and going towards the distal. So the stroke is flowing towards the lymph nodes, but the body parts are going proximal to distal. And this is just because like if you're at a traffic stop and the light turns green, the cars at the front have to move before the cars in the back can get going. And then we're going to do each stroke 3 to 5 times in each position and repeat the sequence about 3 times. And that's for a focus area, not for the whole body. Our strokes themselves, we're going to use the lightest possible pressure without sliding on the skin. So we want to be able to hook the skin, not slide across it, but the lightest pressure we can. We are focused on moving fluid, stimulating the movement of fluid, not pressing and moving tissues. We're going to stretch the skin in 2 directions, laterally and then towards the nodes. So this is that L shape that I may have demonstrated depending on when you're watching this lecture. So laterally and then toward the node. You can also use a wave or a wiggle stroke, left to right. Then we lessen the pressure to 0 and allow the skin to rebound. We don't pull the skin back to the return position. We just allow it to rebound. So if I come back to my little freckles here, here we go. I would hook, like go lateral and then toward the node, and then just release and allow it to rebound. Now my hands are in the new position. Lateral and then toward the node, rebound. Wait. Lateral toward the node, rebound. Or I could do a left to right wet wave, allow it to rebound. Connect, left to right wave, allow it to rebound. Connect. And that's how I kind of move along the body. I hope that you saw that and it was clear. And then we want to wait a few seconds between strokes. Some pro tips are during intake to ask if the client has had any lymph nodes removed or had any radiation treatment. Because if we have compromised lymph nodes during this process, we want to know about it. We do not use lotion or oil for lymphatic facilitation because you need to be able to grip the skin. Music is optional. I like to work with music. It's not, I guess, as part of the ambiance as in massage, but I like to work with it. We want to tell the client to eat lightly the day of the treatment and drink a lot of water before and after the session. This is always true of massage, but it's especially true of lymphatic facilitation. And then be aware that some clients may experience flu-like symptoms following a session. So we can warn them about that, but it helps if you give them enough processing time to like just sit on the table afterwards or lay on the table. During our session, we want to have our table height a little higher than normal because we're not leaning in, we're just applying light pressure. So having them up a little higher is ideal. Most techniques can be applied while you are seated, so that works too. Remember, we're always going to clear the terminus first. And then we're going to start on lymph nodes and then work out from proximal to distal. So starting on like the lymph nodes in the armpit and then going up the arm from there, right? Or start at the front of the hip and go down the leg from there. Always moving fluid towards lymph nodes. The main channel is worked by using diaphragmatic or belly breathing. So the main channel in your abdomen is diaphragmatic. You can take big breaths, or you can do that pumping jiggle thing. We can use gravity to assist our drainage. We can use jostling, rocking, or movement. And we can finish the area with a light effleurage and range of motion. Integration with massage. We can do a full body treatment, which supports wellness and immune system and may cause flu-like symptoms depending on the client. We can do lymphatic facilitation as part of a massage treatment to support specific areas of concern, applying it before or after other modalities. And we can do a standalone treatment used to address areas of acute or subacute injury or post-surgical treatment. So we're doing only lymphatic, but we're not doing a full body. We're just doing it on one area of the body. All right, I'm just going to flip back to the anatomy lymphatic system terms because I'm not sure if we covered them all. A lot of them we did. Cisterna chyli we did not. So the cisterna chyli is this bulge in the lymphatic primary trunk coming up from the legs. It's just there to help hold the extra fluid from the legs. The thymus is a gland in your chest where T cells go to school and grow up to become productive members of your immune system society. The spleen is like a giant lymph node, but it filters blood instead of lymph. The tonsils are lymphoid tissue. You actually have 3 tonsils. You have your adenoids or pharyngeal tonsils, the lingual tonsils at the base of the tongue, and then their pharyngeal tonsils are the tonsils you think of at the back of your mouth. Your appendix is considered lymphoid type tissue. We don't use appendixes anymore very much, but we still have them mostly unless you've had yours out. Bone marrow is on the list because that's where B cells and T cells are initially created. And then Peyer's patches, these are like tonsils. They're like they fight germs in a tonsil-like way, but they live in your digestive tract instead of in your respiratory tract. All right, and that's pretty much our lecture number 2. So I'm going to go ahead and let you go. Hopefully this has been helpful. I look forward to seeing you in class and learning some lymphatic facilitation together. Bye, guys.